Brianna Phillips, and I attend Rasmussen College in Tampa, Florida. Today, the presentation I'll be giving is on non-Hodgkin's lymphoma. So what is it? Non-Hodgkin's lymphoma is a very malignant cancer that is becoming more widespread today. It is a cancer that affects the lymph system and the immune system. It starts out in the lymphocytes and then moves its way to the lymph nodes. The cancer can pop up anywhere on the body where there is a lymph node. Etiology. The etiology of non-Hodgkin's lymphoma is not completely known, but there has been some tests done and theories have been formed. One theory says that people who have had a blood infusion have a higher risk of getting the cancer. This is because when new blood is introduced into the body, the immune system is weakened. Another theory is that the immunodeficiency virus I is a cause for adult T-cell lymphoma. Cells, organs, and tissues. Just like with any other illness, there are organs, tissues, and cells that are affected. The most affected with non-Hodgkin's lymphoma is the lymphoid tissue. The lymphoid tissue is made up of two different lymphocytes. There are B lymphocytes and T lymphocytes. The B lymphocytes are the cells that help protect the body from germs by making antibodies, which they then attach themselves to the germs to kill them. The T lymphocytes destroy cells that are infected, and some can release a substance to bring in other white cells to kill the infected cells. Either one of the lymphocytes have a chance at turning into a lymphoma cell. There are many other organs in the body that can be affected. Those other organs include the spleen, the lymph nodes, the thymus, the tonsils and adenoids, the digestive tract, and the bone marrow. All of these organs play a role in the immune system, so if these organs get compromised, so does the immune system, and it can no longer fight off the diseases our body comes in contact with. Affected body systems. There are two main body systems that are affected by this cancer. They are the lymphatic system and the immune system. The lymphatic system is made up of groups of lymph nodes and lymph vessels. The lymph vessels collect fluids, dissolve proteins, carbohydrates, and fats, and they also will transport the fats to the bloodstream. The lymph nodes are found throughout the body, and their function is to filter out the foreign matter in the body. The lymph nodes will swell when affected and will no longer filter out the foreign matter like they need to. For the immune system, since there will be more bacteria and foreign matter in the body, the immune system will go into overdrive and try to kill it all. The body will try to fight off the lymphoma, but it can only do so much. Signs and symptoms. The symptoms of non-Hodgkin's lymphoma are pretty easy to identify. There will be an enlargement of one or many lymph nodes in the body. Some of these places can include the armpit, the neck, or the groin region. If there is one in the neck area, difficulty breathing and coughing can occur. There are also some systematic symptoms that can happen. Some of those are night sweats, unexplained weight loss, fever, and severe itching. If these symptoms are occurring, then the condition can be much worse than originally thought and the cancer can be much further along. Treatments. One treatment that is used for non-Hodgkin's lymphoma is chemotherapy. It is usually the first treatment option for this disease. This treatment can be very aggressive depending on the stage of the cancer. There are different types of aggressive therapies. There are single-dose drugs like alkaloid and alkylating agents. There are also combination medicine therapies. Some examples would be the MOPP. Chemo is usually chosen over radiation because the cancer is usually widespread and radiation is more for central locations. Another treatment that is commonly used for non-Hodgkin's lymphoma is stem cell transplants. Stem cell transplants are usually used for patients that have relapsed or for patients that have already had chemo. How it works is the patient is matched with a donor, and then the stem cells are then collected from the donor. The cells can be collected from 3 different places: directly from the blood, from bone marrow, or from an umbilical cord. The new stem cells are then injected into the patient's body through the veins. The patient then has to stay in the hospital for 3 to 5 weeks to reduce the risk of any infections. Long-term consequences. Just like with any other cancer or condition, there are long-term consequences. Some of the long-term consequences of the cancer can be from the treatments. Some long-term consequences from chemotherapy include infertility, high heart failure risk, and hair loss that can be permanent. Another would be not being able to live the life normally, because if you had the cancer, you would have to go in and out of the hospitals constantly, whether it be for treatment or just a checkup. One last long term would be the life expectancy. Most people are given a max of 5 years after treatment. Not knowing the life expectancy for the duration of the cancer would be a long-term consequence. Short-term consequences. There are also short-term consequences, just like the long-term. Some can come from treatments. Some short-term consequences of chemotherapy are vomiting, diarrhea, and temporary hair loss. Another short-term consequence would be the symptoms, as they can be treated with medications so they could get better. Also, the treatments and the cancer itself could also be a short-term consequence, depending on how long the treatment takes and if the treatment is successful. There is no real direct causes that are known for non-Hodgkin's lymphoma, so it's hard to take precautions when the cause is unknown. The best thing to do is to protect the immune system from immunodeficiencies. Some ways to do that include practicing safe sex to prevent the contraction of HIV, since it affects the immune system, changing your diet to improve your immune system, so eating more healthy, and lastly, to make sure you get enough sleep to keep the immune system strong and healthy. Thank you for taking the time to watch my presentation. Here is a list of the references I used. Thank you.